You may have already heard of EFT, or Emotional Freedom Technique, and it's also sometimes just referred to as tapping. The simplest way to describe it is that it is a self-help stress reduction technique that's been around since the 90s. And I first started tapping in 2006 with videos by Brad Yates, Nick Ortner, Margaret Lynch, and Alan Davidson. And now there are so many different variations of EFT that you can find online. So clinical EFT is the science-based method that is being studied in clinical trials. It combines cognitive therapy, which is our thoughts and our beliefs, exposure therapy, which is the stuff that causes an emotional intensity, and somatic stimulation, and somatic meaning the body. So we're tapping on the acupressure points of our body. It is not about just tapping on the positive or tapping in positive affirmations. In fact, one of my mentors referred to that as putting perfume on the poop. So clinical EFT, and especially the way that I practice it, really allows us to bring awareness to and process and heal whatever's coming up in the moment. And I will talk more later about neuroplasticity, EFT, and epigenetics, and how EFT can modify the way that our brain processes this emotional information. There are so many different reasons why EFT is fast and can have lasting results. So the latest findings from these clinical EFT trials that have been published in peer-reviewed scientific journals are showing that cortisol levels drop by 37%. Immune system markers go up by 113%. I always start tapping now when I think I might be getting a cold. Pain is down by 43%. Anxiety down 40%. Depression down 35%. PTSD symptoms can be reduced by 44%. The resting heart rate goes down by 8%. Happiness is up by 31%. Food cravings down by 74%, and that is an excellent thing to tap on. Headaches down by 59%, and insomnia down by 41%. And if you would like to look at these trials more, these studies, or find some YouTube videos that really go into these findings more, you can go to my Science of EFT resource page on my website, narniadawn.com. And I also wanted to talk for a minute about this clinical EFT certification. It is a 1 to 2 year process. We have a 4-day training, and then 6 months later, a 2-day intensive training. Then we work with a mentor, and we have to submit 50 different individual session notes for review and feedback. We have a whole stack of textbooks to read, and then we have to do 3 book reports on other books. There are also some ethics textbooks. We have then the big final EFT exam, and then a separate exam just on ethics. And then, of course, there is the expectation of continuing education. So I have to say that I feel extremely confident in this training and the certification. And when you are searching for an EFT provider, I strongly recommend looking for somebody who has gone through adequate training And if you have any questions or concerns, feel free to email me at support@narniadawn.com. I'll talk to you soon.